So, Madam Deputy Speaker, today I am announcing that we will launch a consultation on ending vaccination as a condition of deployment in health and all social care settings. Subject to the responses and the will of this House, the Government will revoke the regulations. I have always been clear that our rules must remain proportionate and balanced. And of course, should we see another dramatic change in the virus, it would be only responsible to review this policy again. Madam Deputy Speaker, some basic facts remain, of course. Vaccines save lives, and everyone working in health and social care has a professional duty to be vaccinated against COVID-19. So while we will seek to end vaccination as a condition of deployment in health and social care settings using statute, I am taking the following steps. First, I have written to professional regulators operating across health to ask them to urgently review current guidance to registrants on vaccinations, including COVID-19, to emphasise their professional responsibilities in this area. Second, I have asked the NHS to review its policies on the hiring of new staff and the deployment of existing staff, taking into account their vaccination status. And third, I've asked my officials to consult on updating my department's code of practice, which applies to all CQC registered providers of all healthcare and social care settings in England. They will consult on strengthening requirements in relation to COVID-19, including reflecting the latest advice on infection protection control. And finally, Madam Deputy Speaker, our vital work to promote the uptake of vaccines continues. And I'm sure that the whole House will want to join me in thanking NHS trusts and care providers for their relentless efforts in putting patient safety first. Madam Deputy Speaker, I also wish to thank the Shadow Health Secretary and the party opposite for their support of the Government's approach to this policy area. One of the reasons that we have the highest vaccine uptake rates in the world is because of the confidence our vaccines that comes from this place, from all sides of the House. We may not agree on everything, but when it comes to vaccination, together we have put the national interest first. It is now in our national interest to embark on this new phase of the pandemic, where we keep the British people safe while showing the world how we can successfully learn to live with COVID-19. I commend this statement to the House.